Hi, my name is Aisha Khan. I am a clinical assistant professor at the Stanford School of Medicine. I specialize in emergency medicine, and my area of interest is triage. Today we're going to talk about my area of interest and why this is an important component of an emergency system that can greatly decrease morbidity and mortality prior to a patient ever coming into your emergency department. Let's start by imagining a scenario. You work in a hospital near a small farming village where the farmers were spraying insecticides when an accident occurred. Two farmers were injured and their machinery hit the water storage for the farm, causing flooding and runoff to go into the village's drinking water. The local council chairman calls you to tell you he's sending 5 patients to your hospital as follows. A 32-year-old farmer who got his hand caught in a spray machinery. It is red and swollen. A 20-year-old farmer whose leg got run over by a fertilizing machine. The leg that got run over is getting bigger. A 14-year-old boy that drank straight out of the water supply while playing on the edge of the village. He is vomiting and unconscious. A pregnant woman with no complaints who is screaming she wants to see a doctor. A 4-year-old with shortness of breath who is awake and alert. Are all of these patients coming in an emergency? Well, there are 2 features that define an emergency. It is a problem that depends on time, and a patient with an emergency may only have minutes to live without help. Or in other words, there is a high risk for a bad outcome. Getting help in time can save a patient's life. Remember, when we approach emergency medicine patients, we have to be prepared to evaluate, think, and act quickly. When multiple patients are coming in and we have to act quickly, how can we meet the challenge? Preparation is the key. Multiple patients are coming in with different illnesses. They are all sick, but some patients are sicker than others. For people with emergencies, time matters. How quickly you can help patients will make a difference to how well they do. Whenever you are in a situation where you have multiple patients at the same time, being able to see the ones that need immediate interventions right away might save their life. Think about the immediate interventions and what the patients that are coming in need the most. Most critical interventions help patients with airway, breathing, circulation, or disability problems. In other words, ABCD problems. Prioritizing your patients based on the potential for critical illness or ABCD problems is called triage. The goal of triage is to prioritize patients, not diagnose them. Triage helps us decide who is most sick when we don't know where and how quickly they need help. An important point to remember is that when we triage, we are simply prioritizing patients based on the minimum necessary information. We are not diagnosing them. Diagnosis takes time, and if you started to try and diagnose the first patient in line, it may become too late for a patient who is more sick at the end of the line. So if we are not going to diagnose the patient with the standard history and physical, how do we decide who goes first? Triage scales are a consistent way for us to sort patients quickly and effectively based on the acuity of the patient. Some scales designate acuity level by number, and some scales designate acuity level by color. The emergency medicine approach applies to triage as well, and though more brief, triage requires an evaluation. Because we are not diagnosing the patient, we do not do a full assessment when a large group of patients comes in. The goal is to identify life-threatening issues that require immediate intervention and to get the patient to a place where a provider can act quickly on these problems. This evaluation should be brief and targeted. So let's think back to our scenario. If these are the patients that are coming in, we might think about what kind of problems they have and what we might like to intervene on quickly. Let's look at these patients and see what kind of problems they have. Our farmer, who got his hand crushed, has a limb-threatening problem. His airway, breathing are not affected, and his circulation is not likely to be affected because the bleeding is controlled. The farmer who got his leg run over, on the other hand, has an expanding thigh. We know that the upper part of the leg can hold up to 2 liters of blood if there's an injury to that area. We might consider that this farmer is bleeding into his thigh and has a circulation problem. Our 14-year-old boy is quite clearly very sick. He drank the water that the fertilizing machine hit, so perhaps some fertilizer leaked into the water. The most important thing to consider here, though, even without knowing that, is that he is unconscious and he is vomiting, so he might have an airway problem. Next, we have a pregnant woman who is quite worried about the health of herself and her baby. She does not seem to have any major problems, but she is screaming and yelling. We can't be sure what her problem is. But here's a word of caution. Sometimes in an emergency setting, we might get distracted by the patient who is making the most noise and making the most demands. Patients that come in may think that they deserve to be seen first because they think they are the sickest, and sometimes because they feel their status in society or their money makes them most important. However, keep in mind that the person who is the most sick deserves your attention first. Usually, people who have airway, breathing, circulation, or disability problems are not the ones that are screaming. Our last patient is the 4-year-old who is short of breath. Clearly, he has a breathing problem. What order would you put these patients in? Well, we know that our approach to emergencies is airway, breathing, circulation, and disability. This order exists because usually a problem with an airway kills you before a problem with breathing, which kills you before a problem with circulation, which will kill you before a problem with a disability. Therefore, I would rank these patients with airway going first, breathing second, circulation third, then maybe the limb-threatening problem, and we can wait to evaluate the woman who is screaming, who is pregnant. This might be the initial prioritization that you consider for these patients. Remember, as always, we need to reevaluate after every action we take, and we may have to reevaluate the order here if the patient condition starts to change. So, to summarize, hospitals are often faced with multiple patients at the same time. Triage is the prioritization of these patients so that the highest acuity patient is the one who is being seen first. Triage allows all patients to be seen efficiently and allows for safe flow of patients through the emergency department. Triage systems are a standardized and consistent way for anyone to triage. And that concludes our presentation on triage. Stay tuned for part 2, which is personal protective equipment and resuscitation rooms.